Stop. Whatever you are doing right now, I need you to put it down and listen to me carefully. What I am about to share with you is critically important, and for many people watching this, it may be the first time anyone has explained this to them clearly. If your knees hurt when you walk, when you stand up from a chair, when you navigate the stairs in the morning, or when you simply try to get out of bed, there is one specific mistake that is almost certainly making that pain worse, quietly, gradually, without you realizing it. And the deeply frustrating reality is that most people have been making this mistake for years, not because they are careless, but because nobody ever told them the truth about what their knees actually need. I am Dr. Matau Jameh. For over 2 decades, I have worked alongside men and women, most of them over 50, who came to me feeling frustrated, frightened, and frankly exhausted by a pain that was slowly shrinking their world. Today, I am going to cut through the noise, set aside the oversimplifications, and give you the medical truth about what is happening inside your knee joint. And more importantly, I am going to give you 4 specific exercises that may begin to change it. Here is what the science actually tells us. According to data from the American Geriatric Society, adults over 50 with measurable weakness in the muscles surrounding the knee face a substantially higher risk of mobility disability than their stronger peers. The Osteoarthritis Initiative, a landmark long-term study funded by the National Institutes of Health, found that this kind of muscular weakness is one of the strongest predictors of accelerated cartilage loss, increasing pain, and the gradual erosion of independent function in older adults. These are not minor findings. These are patterns seen across thousands of patients over many years of careful observation. And here is the part that stops most of my patients cold when they hear it for the first time. Complete rest, the instinct millions of people follow when their knees begin to hurt, does not protect the joint. In many cases, it accelerates the very decline they are trying to prevent. The body was designed to move. When it stops moving, it begins to lose the muscular architecture that keeps the knee stable, supported, and functional. Today, I am going to walk you through what I call the total knee strength routine. 4 exercises. That's all. No machines, no gym membership, no movements that punish the joint before it is ready. And I want you to stay with me through to the very end of this, because I am saving the single most important movement, the one my patients consistently tell me changed everything for their daily life, for last. If you leave early, you will miss the one that brings it all together. We begin with the most critically important muscle in this entire conversation, the quadriceps, the large, powerful muscle group running along the front of your thigh. Every time you stand up from a chair, walk across a room, climb a single step, or catch yourself before a stumble, your quadriceps is either doing its job or quietly failing to do it. When this muscle weakens, and after 50 it weakens faster than most people are ever told, the knee joint itself begins absorbing mechanical stress it was never designed to handle alone. That is where chronic inflammation takes root. That is where the morning stiffness originates. That is where the grinding, aching pain inside the joint begins to deepen over time. The exercise is this. Sit comfortably in a firm chair. Lift one foot just off the floor. Slowly straighten your leg as fully as you are able to. Now, gently pull your toes back toward your face and tighten the muscle in the front of your thigh as firmly as you can manage. Hold that contraction for a deliberate moment, then lower your legs slowly with full control. 3 sets of 8 to 12 repetitions on each leg. Many people look at this movement and conclude it's too simple to matter. I understand that reaction, but controlled activation of a weakened muscle is not a trivial thing. It is, in my clinical experience, precisely where meaningful recovery begins, especially in patients whose pain has already altered the way they move without them even recognizing it. Before we continue, I want to tell you about a patient of mine. Her name is Margaret. She is 74 years old, and she came to see me from Sarasota, Florida. Margaret had been living with knee pain for 9 years. 9 years of telling herself it was simply a consequence of getting older. 9 years of avoiding the morning walks her husband still took without her. 9 years of navigating her own home with a kind of quiet, private fear, always calculating the safest way to sit down, stand up, or manage the stairs. By the time she came to see me, the pain itself had become almost secondary. What had truly diminished her quality of life was the fear, the deep, settled fear that her knees could no longer be trusted. We began a routine almost identical to what I am sharing with you today. Not aggressive, not painful, controlled, consistent, and patient. Within 6 weeks, Margaret walked to the end of her street and back, for the first time in years. I share her story not to promise you an identical outcome, because every body is different and every joint has its own history. I share it because the hidden reality I witness in clinical practice, the one that rarely gets discussed openly, is that fear of movement is often more disabling than the condition itself, and you deserve to know that. The second exercise addresses a muscle group that is almost universally neglected in conversations about knee health: the hamstrings, the muscles running along the back of your thigh. Here is something most people never hear during a standard appointment. Your knee does not function in isolation. Every muscle above and below that joint influences how pressure moves through it with every step, every shift of weight, every moment of daily movement. When the hamstrings are weak, other structures are forced to compensate for that weakness, and that chronic, silent overload quietly drives the inflammation, stiffness, and instability that so many people attribute simply to age. Lie down on your back and place your feet flat on the surface of a firm chair or low couch. Gently press your lower back toward the floor. Now push your heels downward into the chair and slowly lift your hips toward the ceiling. As you rise, concentrate on contracting the back of your thighs. Hold at the top. Then lower yourself slowly, deliberately, under full muscular control. 3 sets of 8 to 12 repetitions. The slow descent is not optional. It is where the strength is actually being built. The third exercise surprises nearly every patient I have ever worked with, and the surprise is entirely understandable because this muscle is almost never mentioned in the context of knee pain: the calf. Most people assume the calf is only relevant to the ankle. That assumption is a significant misunderstanding of how the lower leg functions as a system. The calf plays a direct and measurable role in governing how impact force travels upward through the leg with every single step. When the calf is weak or chronically tight, the knee absorbs forces it was never designed to manage on its own. This is the silently affecting factor behind why some people stretch their knee, ice their knee, receive treatments directed at the knee, and still experience no meaningful or lasting improvement. The problem was never isolated to the knee. Stand approximately 3 feet from a wall and place your hands flat against it, and allow your body to lean gently forward, keeping your feet flat on the floor. From that position, slowly rise onto your toes as high as you comfortably can. Then lower yourself back down with complete, unhurried control. 3 sets of 8 to 12 repetitions. Slow and deliberate, because control in this context is the entire point. And now we reach the exercise I asked you to stay for. The movement that in my years of clinical work I have seen make the most tangible difference in the daily functional life of men and women over 50, not because it's the most sophisticated movement, because it directly mirrors the actions your knees must perform to keep you living independently. Standing up from a chair, sitting down with control, rising from the couch without reaching for something to pull yourself up, getting up safely from a low seat. These are not abstract fitness goals. These are the specific, unremarkable daily moments that define whether a person remains self-sufficient or begins, gradually and painfully, to need assistance. Sit towards the front edge of a firm chair. Lean your body gently forward, shifting your weight towards your feet. Stand up, slowly and deliberately. Then sit back down, lowering yourself under full muscular control. Do not drop into the seat. That is the foundation. 10 repetitions to begin. Now, the progression.
Place one foot slightly behind you and the other slightly forward. Repeat the same movement. The rear leg will carry more of the load, and that additional demand is precisely the point. 10 repetitions with one leg behind, then switch and repeat on the other side. This exercise teaches your body to move again as a coordinated, integrated system, not as a collection of isolated muscles compensating for one another, but as a unified structure that can be trusted. And I want to address something that rarely comes up in a clinical setting, but I believe is one of the most important realities in long-term rehabilitation. When someone has lived with chronic knee pain for an extended period, they don't only lose physical strength, they lose confidence. They develop a quiet, pervasive fear of their own body's ability to hold them. And that fear, that loss of trust in one's own movement, causes people to move less, weaken faster, and decline in ways that go beyond the original diagnosis. What I am offering you today is not merely a set of exercises, it's an invitation to begin rebuilding